So the LEAP-012 is a trial that is targeting patients at intermediate HCC that are those that have tumors in the liver without vascular invasion or extrahepatic spread. This is a double-blind placebo-controlled trial comparing lenvatinib plus pembrolizumab for 2 years plus TACE versus dual placebo plus TACE. So we have randomized 480 patients, and the median follow-up is 25 months. And the trial has two primary endpoints, progression-free survival and overall survival. And in terms of progression-free survival, we hit this endpoint. After 286 events, the median progression-free survival in the combo arm was 14.5 months. In the treatment with TACE alone and placebo was 10 months. Hazard ratio was 0.66 and p-value 0.0002. So the trial is substantially significant in this sense, and this profound effect in progression-free survival was seen across all subgroup analyses. The other endpoint is overall survival. It was now we had the first watch at the interim analysis, and already we identify a trend favoring the same arm, the lenvatinib pembrolizumab arm. The hazard ratio was 0.8 and p-value 0.86. Then there were secondary endpoints. If you want, I can talk about those. Objective response rate. The objective response rate in the combination treatment was 72%, and in the placebo TACE arm 49%. But the substantial information is that among the patients receiving the combination treatment, 56% of them achieve complete responses, which is substantial. Of course, these three effects, progression-free survival, significant difference, a trend in overall survival, significant difference in objective response, come along with some toxicity. And grade 3-4 toxicity for the combination arm was 71%, for the TACE arm was 31%. So this means that TACE alone provides toxicity grade 3-4 in 1/3 of the patients. The most common toxicity was hypertension, proteinuria, ST-LT increase, hypothyroidism, and also the post-embolization syndrome related with TACE. So we think that with the results of this trial is paradigm changing in the sense that we support the fact that with these results, the treatment of patients in intermediate HCC that has been TACE for the last 20 years should be changed to the combination of TACE with lenvatinib pembrolizumab. Yes, so the known effect of TACE without any combination is progression-free survival of 7-8 months and overall survival of 30 months. In the trial, the progression-free survival of the dual placebo TACE was 10 months, slightly better. And here we're expanding that to a median of 14.5 months, but with hazard ratio of 0.66, meaning that we're decreasing the risk of progression 34%. And this is because lenvatinib alone is a very potent TKI that per se is able to achieve objective response of 20%, and pembrolizumab is a checkpoint inhibitor that in combination with lenvatinib has been shown to be synergistic in advanced HCC. So I think that the doses that are delivered here for lenvatinib are the standards of 8 milligrams in patients less than 60 kilos and 12 in patients above 60 kg. And lenvatinib is it's 400 milligrams every 6 weeks, and in advance is 200 milligrams every 3 weeks. I don't see that we can fine-tune the dosage of this. But certainly I think that the adverse events were manageable. Only in 1.7% of the cases led to grade 5 toxicity, so I think this is very acceptable nowadays in oncology. And due to the effect of the drugs, I don't see that the adverse events can be a major problem because they were properly managed by the physicians. Yes, so this was the first interim analysis that for progression-free is final. But for OS, we have 3 additional interim and 1 final. So we are looking for 386 events, or so now we are at 151. So still, we only hit here 45% of the expected events. That's what is immature. So we will follow up, waiting for all the interims and final analysis to come.